The governor and other healthcare leaders continue to urge anyone who wants a test to be tested. And on Tuesday, 179 veterans took advantage of that opportunity in Tulsa. Free drive-through testing was available at the Ernest Childers VA outpatient clinic. They ranged in age from early 20s to late 80s, and nurses administering the test confirmed that they are definitely seeing an increase in positive tests and patients experiencing actual symptoms. In this O&R Extra, we present the latest COVID-19 information and recommendations.
We've seen a real surge in new cases in Oklahoma that started right around the 1st of June. The red line on the graphic is the 7-day rolling average of new cases, and you can see that that number was going up almost exponentially for about 2 weeks. The week of May 25th, only 1.8% of the tests that were completed in the state were positive. And for the past 2 weeks, about 6% of all of the tests run have been positive, but over the past few days, that number has been as high as 7% of the tests. Going forward, we're going to see more deaths in Oklahoma because we have some very, very sick people that are now hospitalized with this disease.
We aren't terribly happy with the caution that individuals are taking in terms of mask wearing, and it tends to be that young group in that 18 to 35. And so it is profoundly important that people really grasp the significance of what universal masking can do for this pandemic.
I would caution people not to over-utilize some of the therapies that have been out in the public that include high doses of vitamin C and high doses of magnesium and high doses of vitamins, because some of those can actually backfire on you.
So one of the big projects we have going right now is a project that's centered around immunity post-infection. And so we use our biosafety level 3 lab that we have here at the university to actually take the blood from those patients and the antibodies from those patients and see if they're able to block the entry of the virus into cells in the lab.
I think there's more than 150 vaccine initiatives. There are 15 or so that are in clinical trials. There's one, the lead vaccine is AstraZeneca's, which is now gone to phase 3. There are several in phase 2.
If we assume in the United States that we would need to get about 60% of our population with immunity to achieve what everybody talks about, herd immunity, we'd have to give, assuming no infection, we'd have to give 198 million doses of vaccine. No company is going to produce 198 million. So it's going to take multiple companies building the vaccines to get there.